quarantine and disinfection to avoid any unnecessary gathering. Especially, we must speed up the vaccination among the elderly population. By April the 5th, the cumulative reported vaccination nationwide is 3.2 billion population. And the number of vaccination with 3 doses completed was 1.2 billion. Right now, in Shanghai, the pandemic is worsening, and prevention and control is critical. According to the State Council arrangement, together with 15 provinces, the National Health Commission has dispatched a lot of medics, and every day there are a lot of nucleic acid test tubes being sent to Shanghai to help save and treat those infected population. And if needed, there will be more support. And today, the presser is themed under how to work on pandemic prevention and control in a stringent and pragmatic manner. We have invited the Deputy Director General of the CDC, Mr. Lei Zhenglong, from the CDC Epidemiological Chief Expert, Mr. Wu Zunyong, and Chief Expert in Immunology, Mr. Wang Huaqing, from Peking University No. 1 Hospital, Mr. Wang Guiqiang, and they will take your questions together. Now let's open the floor to any question. Please identify yourself before raising the question. From Xinhua News Agency, my question is, what are the features right now in terms of the virus transmission? Let's give this question to Mr. Lei Zhenglong. Thank you for the question. Since March the 1st until April the 5th, the cumulative local infected cases were 170,000, and it involves 29 provinces. In general, it's quite widespread, and there are sporadic outbreaks and the large concentration of cases. Since mid-March, the localities have implemented the pandemic prevention and control measures, especially among the 5 severely infected provinces, Guangdong, Shandong, Hebei, and others, have now been picking up. But in Shanghai and Jilin, the situation is still worsening. Shanghai is at the summit of the infected population of a cumulative reported case of 90,000. And the virus has been transmitted to multiple provinces in the surroundings. So the pandemic is quite severe in Shanghai. In Jilin, the cumulative reported cases are 60,000. Especially in Changchun City, the number of the infected population is standing very high. And in Jilin, the city is still having a severe situation. So we must take quarantine measures, control measures, and the screening process and others. And with those measures in place, we can achieve the goal of dynamic eradication of the cases. The joint prevention and control mechanism will guide different localities to increase their capacity in responding to this new round of virus. We must work as one mind and focus on the key regions, take pragmatic and quick actions to put these measures onto the ground. Thank you. Next question. From CMG. Recently, there have been the sporadic outbreak of the virus across whole China. So how long do you think this situation will last? And with the warming season coming to us, will the situation be better? Mr. Wu Zunyong. Thank you for this question. As to how long this situation will last, it depends on our prevention measures and the execution with the strenuous support and leadership of the CPC Central Committee, we have been working on curbing the imported cases and the transmission of domestic cases. We have taken pragmatic measures and take solid measures. Right now, if we continue these measures, the situation will be improved very quickly. Since the world is plagued by the fourth round of the outbreak, especially in Hong Kong SAR, the virus is being transmitted widely. So the pressure on us is huge in terms of preventing the imported cases. We must take quick actions and encourage immediate report, immediate quarantine, and immediate treatment so that those prevention and control measures will be put into effect. But this requires the coordination and understanding of the masses. They must set up and foster correct concepts and good habits in order to implement those measures. Especially, we must identify that you must be responsible for yourself when implementing the measures. For example, put on the masks, keep a social distance, wash your hands frequently. If everyone can do accordingly, then our situation will be quickly improved. Thank you. Next question. From the Phoenix TV, nucleic acid testing involves different procedures with the massive screening going on. How can we guarantee the standards being abided by in this screening process? Mr. Wang Guiqiang. Thank you for this question. Yes, indeed. It is a complicated process to take the samples, starting from organizing the population to the sample points, to the sample taking process, to the test results. It's a complicated procedure. So, for one thing, we must quickly organize the masses to arrive at the sample taking points for the nucleic acid test. Meanwhile, we must standardize the procedures of sample taking, especially in terms of the management. We must avoid any crowding or gathering of population. And as to the individuals, there are several things to work on. For example, before the test, we recommend you not to eat anything 2 hours before the sample taking. That will avoid vomiting or nausea during the sampling. And also put on the facial masks and take some other protective measures. And also, we do not advise you to drink water 3 minutes before sample taking, and do not have gum, and do not drink alcohol before sample taking. Secondly, you should cooperate with the medics. For example, you must open your mouth and listen to the guidance of the medics by doing those moves. And afterwards, you should not linger on the sample taking points. You should leave the sample taking stations quickly after completing your test. Do not throw litter in the surroundings. After sample taking, you should continue the self-protection. For example, keep a good sanitation of your hands afterwards. So, in general, your active coordination during the nucleic acid test will guarantee our smooth implementation of the test policy. Next question, please. Thank you. From the Macau Monthly. How to get vaccinated in the springtime, because there may be some allergic reactions in the spring season. Mr. Wang Huaqing. Thank you for the question. We know that it's a blossoming season in spring. There have been some cases of allergy among the population. For example, itchy eyes, coughing, or sneezing, or asthma. Of course, there are certain measures to avoid the allergy to pollens. You could keep away from the environment with pollens, and if you do get an allergy, you could use some medication to treat it. As to the vaccination, there are 5 different diseases that should be alerted not to take the vaccination, but the pollen allergy is not one of the 5 contraindications. As to the contraindications, for example, you have once received the related similar vaccinations and you were allergic to it, then you are not advised to take it anymore. Secondly, if you are allergic to certain components in the vaccine, you are not advised to take the vaccine. Third, if you have taken other vaccinations and you were severely allergic to them, you are not advised either. I should emphasize the point that while receiving the vaccination, if you are in the acute period of allergy, for example, to the flowers, and there are some other complications, we advise you to delay the time of vaccination. Also, after receiving the vaccination, you should stay 30 minutes on the site to observe your health status, just to avoid any possible allergy. And if you do have some reactions, we would take instant measures if you are on site. Anyway, preventing and controlling the COVID-19, especially the deadly cases, vaccination is the best way out. For those who have not received vaccination, even with the allergic reaction to the pollens before, but with no acute symptoms right on, should be advised to take the vaccination. Thank you. Next question. Thank you. From the CMG. For the mild cases and asymptomatic carriers, what is the situation considering their curing and confirmation process? What treatment can they receive in the temporary hospitals, and what if their health status are worsening? Mr. Wang Guiqiang. Asymptomatic carriers sometimes are in the incubation time period, and sometimes they have continuous asymptomatic situations. For some, they may be progressing. Of course, these symptoms might be progressing even during the incubation period. So we advise the asymptomatic carriers to have some company of the medics. So in the temporary hospitals, we will assign some medical professionals and resources, especially the equipment, just in case. And the Joint Prevention and Control Mechanism in March published a guideline about managing the temporary hospitals, stating that there should be certain proportion of treatment and diagnostic equipment and medics in the temporary hospitals to guarantee there should be regular treatment and monitoring of the diseases or any progressive development of those diseases. As to the criteria of being enrolled into the hospitals for the elderly people, for the people below 60 years old with no mild diseases or basic diseases, those are the so-called mild cases. They meet the criteria. And for the mild cases and asymptomatic carriers, they must keep a close eye on their symptoms. If they have some basic diseases or heavy diseases, put more premium on them. And for the risky population, if they present mild symptoms, we recommend medications, particularly the antibacterial treatment. And we must monitor closely the progression of all patients, especially those with some basic diseases and the elderly population. If they discover any change or any progression of the disease, take immediate action to respond and call for the ambulance to transfer the patients to designated hospitals for further treatment. Thank you. Thank you from the China Review News. There have been some complaints of the insufficient supply of the medications, particularly among the risky population. So how to meet the demand and how to solve the last 1 kilometer issue for the patients in acquiring the treatment and medications. Mr. Wang Guiqiang. In the prevention and control process of the pandemic, the basic treatment and the COVID-19 prevention are equally important. We keep emphasizing that while regularly controlling and preventing the transmission of the virus, we must meet the regular medical demand of the other patients, especially the heavy diseases. In the controlled areas, there have been some rising need for medical treatment. We must take immediate actions to guarantee their medical needs. In terms of that, our mechanism emphasizes that for the medical institutions and the medic staffs, there should be some rules to abide by. For example, in the wards, in hospitals, there should be some specific buffer zones. For example, in the gynecology and obstetrics department, there should be such a buffer zone to meet the special need, and we must pay attention to those pregnant women or the dialysis patients so that those patients are followed closely. If they need treatment, they could receive the help immediately. And also, there should be some hospitals nearby to prescribe for some chronic diseases. We recommend that the prescription could last for 12 weeks, and there should be some doorstep services to help those patients suffering from chronic diseases. For the medical needs in the controlled areas and risky areas, there should be some counseling services. We must give full play to the advantages of online hospitals so that the civilians do not need to go out to receive medical help. As to how to solve the last 1 kilometer issue of receiving medical help, for example, going out of the neighborhood and go to the hospital, such an entrance and exit require the coordination system between different departments. By working together with the hotline 120, we hope that those hotlines could be given full play to. And secondly, in the transportation process, we must properly arrange the vehicle to solve that issue for the civilians. Those two measures require coordination between different entities, sometimes in need of the government resources and designated vehicles. Thank you. Next question. From the cover. In last week's presser, it showed that now the key challenge of dynamic eradication of the cases is about the quick transmission of Omicron. We must increase the sensitivity of our monitoring to discover any possible case quickly. So what are the measures taken about it? How can we quickly identify the close contacts so that they could be kept in our monitoring? Mr. Wu Zunyo. Thank you for the questions. As to early discovery of the virus, there are two ways. One, preventing the imported cases. Two, preventing the domestic rebound. First of all, for the people entering into our borders, we must have some isolation period to monitor their situation, to avoid further transmission of the cases from abroad. And secondly, for those cold chain and logistics personnel, there should be some daily monitoring. Then we can discover the transmission through objects and cut the chain of transmission to people. Then we will immediately discover any virus through the two measures. And further transmission will be prevented to the other close contacts. We believe that's the quickest and most efficient policy in preventing the transmission from abroad. And secondly, let's look at how to avoid a domestic rebound. For the affected provinces and cities, we must avoid the transmission outward. The infected people are not allowed to travel to other unaffected places. Secondly, we must have clinical monitoring to identify the infected people immediately, especially the population with cough or fever or any other suspected symptoms. They are advised to take a nucleic acid test to have an early discovery. Third, it relies on our masses. If you have any throat pain or a cough and you are suspicious of a potential COVID-19, we recommend you to take an antigen test voluntarily. If the test result is positive, please report your situation to a certain entity in order to take certain measures accordingly. So once any infection is discovered, we must quickly survey all the close contacts on the transmission chain in order to discover the close contacts quickly. And there are two keys to identify them. The first one is selection. The second one is quick response. There are certain measures to help us out. For example, the epidemiology survey. We will ask questions about the work, life, and the traveling history in the past few days of the infected people. For example, who they met in the past few days. That would help us to identify the close contacts. And secondly, we resort to the big data. We will try to find out if any people have the overlapping places or time periods with the infected population. If there are, we will do another screening to identify the close contacts. Thank you for the questions. Next question. From People's Daily. What is the progress made in terms of vaccination? As to the people above 60 years old, what is the vaccination situation? Mr. Lei Zhenglong. Thank you for the questions. According to the Joint Prevention and Control Mechanism arrangement, right now we keep asking different localities to encourage the vaccination. By April the 4th, the cumulative vaccination number nationwide is 3.2 billion doses. The total population is about 3 billion as well. So 1.2 billion people have once received a vaccination. That is about 97% of the total population in China. Completing the vaccination is our target, and 700 million population have completed the 3 doses. For the people above 60 years old, 200 million population have completed above 60 years old. Right now, the pandemic is complicated. Vaccination added by effective personal protective measures are effective in preventing the transmission. So to continue the vaccination, we have been encouraging the elderly to take vaccination, and we also consider the innovative measures in different localities. Our goal is that people can timely complete their vaccination according to the procedures. So here, I would love to ask you to receive the vaccination proactively. Next question. From the 21st century, according to some experts, in Jilin province, the heavy and dangerous cases are usually among the elderly people, and they usually receive less vaccination in proportion. So, in face of the Omicron virus with quick transmission, if the elderly people do not receive vaccination, they are more vulnerable. Is that true? Mr. Wang Huaqing. Thank you for the question. Actually, we have noticed about that analysis. There is one designated hospital in Jilin province. In that hospital, the heavy and dangerous cases receive less proportion of vaccination. Only 15% of those population received vaccination. That proportion is far less than the average level nationwide. Among those heavy diseases, we did discover the symptom that they receive less vaccination, they usually have some basic and chronic diseases. We know that there are two risky factors leading to death. One is old age. The second is basic diseases. Now there is a third risky factor, that is no vaccination beforehand. As has been mentioned, Omicron is a mutated virus. It has quick transmission, and it's usually transmitted invisibly. So that will lead to higher risk of infection. For the elderly population and those with basic previous diseases, one key helpful measure is vaccination, because vaccination can help us to reduce the mortality and the heavy symptoms. After receiving vaccination, in preventing the heavy symptoms and the death cases, there have been some good results. Previously, some experts were evaluating the effectiveness of the vaccination in reducing heavy symptoms and death cases. According to the experts, it's extremely effective, and they believe that such an effect is incredible. That's an international comment and consensus. But still, I have to stress again that for the unvaccinated population, for the vaccination to take effect, it takes time. For example, it will only take effect after 14 days of vaccination. And you need a booster in order to further enhance the efficacy of the vaccine. So we advise everyone to receive the vaccination if you haven't, especially when the Omicron virus has higher transmissibility. Next question. Thank you. From National Business Daily. In the version 3 nucleic acid test guideline, it says that we must properly handle the medical waste. So what are the pointers in disposing those wastes? Mr. Wang Guiqiang. Thank you for the question. It involves sample taking, transportation of the tubes, and lab test and report. And in those procedures, there will be some medical wastes. So how to dispose the medical wastes is very important. Otherwise, there will be some potential risk of transmission. The nucleic acid test version 3 guideline specified that we must step up our management of those medical waste. First of all, we must set up stringent procedures in the waste collection, packaging, non-hazardous treatment, transportation, and delivery. Secondly, the guideline requires very strict criteria of packaging. There should be 2 layers of package, and there must be proper sealing to ensure that there is no leakage and spill out. Thirdly, there should be a special team responsible for the treatment and disposal of the medical waste. There should be specific transportation entity, the storage points, and other special dedicated organs. In addition, the medical wastes must be disposed on the same day of production. In the nucleic acid test stations, the storage of the wastes should be no more than 2 days before disposal, and we must take quick and effective measures to dispose them. Besides, as to the transportation of the medical wastes, we must avoid the transportation in windy days or rainstormy days to avoid any uncertainties that may lead to the leakage of the wastes. The receiving entities of the waste must optimize the transportation routes and have proper plan in place. Next question. Thank you. From Beijing News. In the last presser, we heard that there have been some studies about the Omicron virus, for example, the fatality rate and infection rate, and it was mentioned that the number of deaths in the same time period incurred by Omicron is larger than that of Delta virus. So what are the new updates of the study of that Omicron virus? Mr. Wu Zunyu. Thank you for the question. Speaking of the death cases caused by Omicron, that was said to be larger in number than the number of Delta. We did our analysis of the exposed data from other countries. For example, take the UK as an example. We analyzed the cases in the UK in the 3 months starting from August to November in 2021, and also the 3 months starting from November 2021 to January 2022. For example, in the first time segments, the mortality rate is 16 people per 100,000 population. But as to the second time period, starting from November 2021 to January 2022, which was dominated by Omicron virus. In UK, the mortality rate is 22 per 100,000. So that was 16 to 22. We also analyzed the data from the US. In the same 2 time periods, in the first time period, the mortality rate in the US was 40 per 100,000 population, but in the second time period, when Omicron dominated, the mortality rate is 42. If you multiply that number by their total population, then the number of deaths is 6,000. Now let's look at the cases in Hong Kong as they are. We analyzed the data published by the government. The fifth round of outbreak in Hong Kong has caused 1.16 million people infected. Among them, 8,136 people died. That casualties caused by Omicron virus was more than the sum of the previous 4 rounds of outbreak in Hong Kong. If we look at the Chinese mainland, from January to March 2022, the reported cases in the Chinese mainland involve 197 heavy and dangerous diseases. Why our mortality rate is much less? We have taken certain measures. The first one is paramount, our dynamic eradication of the cases. So we control the scope of infection to avoid massive death. And secondly, for all infected people, we have an overall management. So we could quickly identify those heavy diseases to further avoid possible death. And thirdly, for the dangerous cases and heavy diseases, we offer intensified medical services to them. For example, we use the plasma and the antibody to reduce the death cases of the heavy symptoms and the dangerous cases. And the last measure is the widespread vaccination. Next question. My question is, compared to the vaccination from the same source, is there any difference in terms of the vaccination targeting at Omicron? Now we see different types of vaccines, and with the time passing by, they share the reduction of effects. We hope to increase the efficacy of the vaccines by encouraging the boosters, especially for the elderly population and those suffering from basic diseases. That's the global consensus. And in the real world, after receiving 3 doses, compared to the 2 doses package, the efficacy is higher. And according to the surveys, there have been more protective results. So, according to some researches, we could increase the titration. Now, we have introduced the policy of receiving a booster of the same source in order to increase the efficacy of vaccination. The urgency right now is to encourage the qualified population to receive the boosters as early as possible. That is one of our top priorities. Thank you. The last 2 questions. Thank you from Hongxin News. The local newly added infected people are right now mostly the mild cases or asymptomatic carriers. People are saying that Omicron is less harmful. Is that true? Mr. Wang Guiqiang. Thank you for the question. Now, Omicron virus is rampant. In general, mild cases and asymptomatic carriers are dominant. One reason is Omicron is less toxic. It usually infects the upper respiratory tract, not the lower tract. And secondly, China benefits from widespread vaccination. Third, voluntary nucleic acid test. So many infected people were discovered during the incubation period. Of course, for the youngsters, there are more asymptomatic carriers and mild cases once infected with Omicron. But the less toxicity is compared to the previous viruses. According to the available data, it's still more harmful than flu. Take Jilin province as an example. The death cases and the heavy symptoms are usually those populations that haven't received vaccination. That's one manifestation of the harm caused by the Omicron. Right now, there are 8,000 death cases, and the mortality rate is 0.7% in Hong Kong. That's larger than that of influenza. So, from the data from Hong Kong, we learn that there is high correlation between vaccination and mortality rate. Take Hong Kong again as an example. The mortality rate is 3.2% among the population that haven't received vaccination at all, and that rate is 0.14% for those populations that have received 2 doses, and that rate was 0.03% for the population receiving 3 doses. So we must stay vigilant about vaccination. We must take effective prevention and control measures and encourage the vaccination, especially among the elderly population and those suffering from basic diseases. After receiving vaccination, those 2 groups of population can reduce the harm caused by Omicron. So here I would love to urge the elderly people to receive vaccination quickly, especially the booster, because only when we can better protect the elderly population and those suffering from the chronic diseases can we really reduce the cases of Omicron. Last one question. There have been some new virus mutations, XE, and according to the WHO, there might be further mutation of the virus. So will this influence our vaccination? And with the new change of the virus, maybe the severity of this disease will be undermined by the mutation. So what is your take on that? How can we respond to the continuous mutation of the virus? Mr. Wu Zunyou. We've noticed that there have been some reports about the XE virus. And we are sourcing the transmissibility and the scope of infection of this new virus based on the last 2 years of research and our previous understanding of the RNA series of viruses. We come to the consensus that it is only natural to have continuous mutation of the virus. So we are fully prepared for that change. And no matter how the virus changes, our regular prevention and control measures, for example, early discovery, early reporting, early isolation, and early treatment are always effective. Together with widespread vaccination and the self-protective measures like washing hands, keeping social distance, putting on facial masks, and others. Those measures can effectively control even the variant viruses. But if you question whether our testing tubes are still going to be sensitive to those variant viruses, or whether our vaccination are continuing to be effective in preventing the death cases, whether it's necessary to further upgrade our vaccination as well, we need more scientific surveys to update our knowledge. Thank you for the question. Thank you, Mr. Wu Zunyu, and all the experts for taking the questions. We will continue the pressers in the future. Please stay tuned with us. And if you have any question, please send them to us. And this is the end of today's presser. Thank you.